Hey, Anna. Good night, Anna. Good night, community boat 9.
Hey, friend, it's Khalid. I can't connect my video for some reason, but I'm here.
Try logging up and come back in.
Oh no, it's like it's the laptop and the system. It's not acknowledging the camera on my laptop for some reason.
Oh, okay.
Yeah, but I'm here.
Okay, cool.
Hello, everyone. Can you hear me?
Hi, Anna.
Hi.
How are
Can
you?
you see me too?
Yeah, I can see you.
Okay. Hi, everyone. Hi. Hi, this is
Hi.
Anna. So trying to reach Dr. Manyendo. I haven't heard from him in a couple of hours. So I'm just trying to make sure everything's okay. But I'm going to be on and waiting for Teresa Doherty from Health and Hospitals Test and Trace, who'll be able to join as well. And we have a slide deck that we can use if you'd like. I can share screen, right?
You have a slide what?
I said we have a slide deck that we could use.
Okay.
And if we decide, checking with Dr. Manyendo, if anything, I'll be sharing the screen. Would you be able to grant me the privileges to share once it's our turn to speak?
Yeah. I'm Khalib. Khalib.
Yes, Fran, I'm here.
You'll be able to give her access to share screen.
Let's see here. Hold on 1 second. Here, Anna, I'll just make you a co-host as well. You should have those same sharing capabilities, okay?
Okay, perfect. Oh.
Do you have it?
Perfect, I have it now. Yes, thank you so much.
There you go. Take care.
Yep. And Teresa Doherty has joined us as well. Hi, Teresa.
Hi, how are you?
Good evening.
Hi.
Hello.
Good evening. All right, I'm going to go try to find Dr. Manyendo, and I will be right back.
Okay. How are you, Teresa? How was your day?
I'm well, thank you. Thank you for letting me join.
You're welcome.
Thank you. It's been a long day, but I get to keep doing this work, so I'm happy to be here.
Yeah, been a long day.
I do appreciate that community boards, do this well into the night, many nights a month. So I appreciate your service.
Yeah, we do. The information given is it's needed.
Exactly. So we're happy to be here.
Thank you so much for being here.
How are you?
Hi, Enid. Hi, how are you?
I'm good. How's everything?
Not bad. I was thinking about you today. I said I'm hoping that you come on board.
I am here.
Yes, you are.
Did you got your masks and everything worked out wonderful for the food giveaway?
Yes. And I thank you so very much.
You're very welcome. If you need more, I told Mia, just let us know because we do have a backlog of them.
Okay. Thank you. Hi, Cindy. How are you? Good to see you. Happy that you're able to join. I guess when we start, then whoever will show their face. I like to see when the meeting is going and we're introducing ourselves. I like to see faces as to who I'm interacting with. How was your day? How was your day, Enid?
It was good. Very, very busy.
Yeah.
As you can imagine, this time of year, we're trying to do so many things at once, as well as respond community needs. So it's busy, but busy is good.
Yeah, definitely so. Busy is good.
What about you?
As anything else, as you know, working from home, but then working from home and then doing stuff in the community. So the two passion, it's kind of it's busy, tiring. I wish I can just fly home and sit on the beach for a few days.
Oh, I know. My father-in-law, he does between Jamaica and Brooklyn, and so he's gone.
Wow.
When it gets cold, he says bye. He's out, and he's not even from Jamaica. He just decided, I am going there.
I wish I can do that.
Me
I would
too.
love to do that.
Me too. Oh my God, I'm envious.
I wish. Yeah.
Hello, Francesca.
Hello, Mr. Burke, and how are you?
I'm very
Hi,
good. How are
Cindy.
you?
Hi, Miss Leopold.
I'm good. Hello, Ariel.
Hi, everybody. Nice to meet you.
Same here. Same here. It's nice to put a face to the name.
Hi, everyone.
So
Hello,
we'll just
Cindy.
we'll wait for let's give Melissa. Hi, Melissa. Give people another 3 up to 7:05.
Hi, everyone.
And usually I would like to start promptly, but I know people start really coming in 7:05, 7:10. But at 7:05, we will start doing the introductions, as to who is here. And but because of the message that will be given, I would really like some more people to come so they could really get the message and they could hear what is being shared. But in the meantime, welcome everybody. Hope that everyone is keeping safe. Okay, it's now 7:04.
Hey, Francesca.
Yes, sir.
I was speaking to a senior that I know on Fenimore Street, and I'm going to drop off some masks at her house. They're out of mask. But I was thinking maybe we should do a pop-up down there.
We'll talk about that offline because we get to figure out which mask that we're giving out from the board.
I know I got
From the
yelled
board
at.
up.
I was yelled at.
Okay, we'll talk about that offline. So now it is 7:05. I welcome each and every one of you for being here tonight. I'll go around introducing names, who we are, what the organization that we are from. But there is something else I want you to do for me. I like interaction. I don't like, we have a hard day, long day. Most of us sitting at the computer all day. So I usually have my meeting once a month. And my meeting, I don't want it to be just sitting down and everybody watching me and just hearing me talking and getting you sleepy. So I want people, let's interact. Every time you log on to my meeting, you're my family and we become one family. Okay, so when you live here, you know that you have an extended family. So what we're gonna do, we will introduce ourselves, name, organization we are from, and with everything that's happening outside, around us, television and everything, I just want you to share with us. That's one thing, good thing that happened this week, maybe last week, that just distracted you from all the chaos and that made you happy. One good thing. So I'm going to start with Teresa. Teresa, you'll unmute yourself. You could unmute yourselves. Introduce yourself, your organization, and that one good thing that made you happy in spite of everything that's going on around you.
Well, thank you. My name is Teresa Doherty, and I'm with the New York City Test and Trace Corps Outreach Campaign Team. So I'm very happy to be here to support the Department of Health and let you know about how else, we are really hoping to connect with our community boards to get through all this together. The best thing that happened to me this week is that I drive an 18-year-old Saturn. they stopped making Saturns like 10 years ago. But on Monday, it passed inspection for yet another year. So I'm very grateful because I was a little worried that this might be the year. So that was my one tiny distraction that brought me a little bit of joy.
Wonderful. Thank you so much for sharing. So Enid.
My name is Enid Dillard. I'm the Director of Marketing and Public Affairs at Kingsbrook at One Brooklyn Health. And it's a pleasure to be here, by the way. And the one thing that brought me a lot of pleasure and distraction this week is that my mom is living with me. I take care of her, she's elderly. And she went to her cardiologist this week thinking that she had a problem. And he told her, you're going to live until you're 100. And she's 90. And I thought, yay! And so that was wonderful, and just glad to hear that she's doing so well. And it made me feel good that I'm doing a good job with her, because sometimes it's very hard with working and taking care of a family. And I thought that was a blessing to me.
Wonderful, wonderful. Wow, that's a blessing.
Yeah.
Ariel.
Hi, everybody. Okay, one good thing. Well, this week was tough. It was with Thanksgiving and everything. I thought I was going to be going home to my family's house. I had plans to get COVID tested and everything the day before. And last minute, my parents called me, and my 92-year-old grandma lives with us. And they were just like, we're just not going to be able to do it this year. So I was devastated, as I was really looking forward to just being at home. But I ended up being with my sister in the city that day. And we actually had a really nice day. We walked around Williamsburg and went to dinner, and it didn't necessarily feel like Thanksgiving, but it was a really good day with the two of us. So I was grateful for that and to have her close by on Thanksgiving.
Wonderful. Okay, we're going to go to Cindy.
Good evening, everybody. Can you hear me well? I just want to make sure my headset is working. It's good?
Yeah.
Great. Well, this is my first time here, so thank you, Ms. Leopold, for inviting me tonight. And I am from New York Connects Brooklyn, which is an information and case assistance line with the Department for the Aging. And I am here as the outreach coordinator, and I'm also a social worker on the team, hoping to connect to more seniors through other partnerships and other social service organizations, and trying to learn more about your programs as well in an effort to gain more outreach efforts throughout the community. We service all of Brooklyn, so we just want to get the name out there. And if anyone has ever given us a call, you may know of us, or if you've ever Googled us or Googled anything pretty much throughout Brooklyn, sometimes you get directed to New York Connects. And one great thing, so actually it has been a very rocky week because seeing family has been difficult, and making smaller family gatherings and plans, especially coming from a very large family. So I only spent Thanksgiving with both my parents. And aside from that, I think that the highlight of it was actually putting up our Christmas tree right after Thanksgiving, which never happens in our home. It usually happens about the last week before Christmas. And for the first time, I've actually helped my parents put up their tree. And now I'm actually at my brother's house putting up his tree. So it's like a bunch of Christmas trees are going up. So it's the light of the spirit. I think the holiday spirit is in us. So that's a big, good thing for me.
Wonderful. Dr. Noel?
Thank you.
I don't want to say the last name, but I don't want to butcher it, so I'm just going to say Dr. Noel.
Appreciate it. Hi, this is Dr. Noel Maniendo. Thank you so much, Ms. Leopold, for having me on here as well. I really appreciate it. So I had just stepped down from my role as Assistant Commissioner with the New York City Health Department, but I continue to be a volunteer around, particularly around the COVID work that we're doing in neighborhoods across the city, particularly in Upper Manhattan, the South Bronx, Central Brooklyn, North Brooklyn, parts of East Brooklyn as well, and parts of Queens as well. So I'm grateful for this opportunity to be here with you guys. One good thing to in the last week or so is the news that I received. So just FYI, so I'm a physician by training. I have lost since the beginning of the pandemic 6 former colleagues to this virus, and then there's another 4 maybe family members who have also died due to this thing. And so I got the good news that one of the folks who I know who was in the ICU was stepped down from the ICU and is continuing to recover, and it looks like he might be able to make it out of this thing. So it's really that just, you know, with all the pain from all the people we've lost, not just colleagues in my case, but no, people that I live in Harlem, you know, people in the community, the neighborhood, former colleagues. This was just good news to hear that there was, you know, this was a recovery case. So I just, you know, that was the biggest thing for me the last week or so.
Blessings, blessings, blessings. Wonderful. Anna?
Hello, everyone. My name is Anna Schatz. I'm with the Community Affairs Unit at the Department of Health and Mental Hygiene. Since COVID, I've been activated to work in Public Information Office and do a lot of the speaking engagements and coordinating events to make sure that community members and organizations receive all the information and you know, guidelines and help navigate all of the changing information that's happening rapidly, day by day, feels like. And something good this week, oh boy. So yesterday, actually, I had to take an Uber ride in the evening to get somewhere real fast. And in the Uber ride, I was actually able to talk to someone. The driver was just like venting how he's not sure about like testing or, you know, where to go. And he's getting all of this information. And just in my regular day-to-day life, I was able to help him navigate and answer his questions and just have that one-on-one. And he was really thankful at the end, saying this was the most, you know, normal conversation he's had, the most real information, got him resources, right? Wrote things down like on a back of a piece of paper in his car. And that felt good. And, you know, just make sure that he's going to get tested today. And he, you know, found a place to go to get tested without having to pay over $100. And that, you know, takes, you know, his insurance, all of that kind of stuff. So that was good. That felt good.
All right. Wonderful. Melissa.
Hi, good evening, everyone. My name is Melissa Severe. I'm a member of Community Ward 9, and I also work at Department of Health. One thing I guess I'm grateful for this week, this is very simple, but my my office chair finally came this week. And, you know, because we've all been working from home, I wasn't prepared for that situation, and my back suffered because of it. And I was grateful that I finally got my chair. Very simple, but it was important to me. Thank you.
Yep. You're welcome. Mr. Burke.
Hi, everybody. I'm Warren Burke. I apologize for not being dressed properly. I just realized that is why I have my camera off. But I had a lot of good things happening this past week. The first thing is this meeting right now and looking at the people who are here and the expertise involved, and to be open with you, that makes me very, very happy, because I really, as importantly, we're facing severe challenges. And just to introduce myself, I'm the first vice chair at CV9, and I am also the chairman of the Kings County Advisory Board. And for that young lady from the Department of Mental Health, I do sit on the Department of Mental Health subcommittee. So we're very proud of the work that you're doing. The other thing is, let's see, Thanksgiving. You know, Thanksgiving was really interesting because I have a pretty crazy family. And I remember back in the day of when my kids were young and everything else, you know, a lot of Thanksgivings I would say that, you know, I really wish I didn't go. because there was all this interdynamics going on. And so I said to myself, Thanksgiving meeting, well, now you have it. So I had a very quiet Thanksgiving. I had lunch with a friend, which was very nice. And then for dinner, I was by myself and I made some turkey parts and I was very happy. The third thing is that I ride a bike a lot and it's pretty well got me mentally through COVID. But over the weekend, I was riding by Prospect Park. I live in Crown Heights, obviously. And there was this great band playing in the in the Grand Army Plaza, and it was just phenomenal. And it was so nice. There had to be a lot of people there. I do believe, some of them were not following protocols, some were, but it was just such an uplift just to listen to this live music. And I played the drums back in the day, and I was just watching this drummer, and I just totally got enthralled and enjoyed it. Thank you.
Thank you, Mr. Burke. Philip, are you there? Okay, so we have someone on the phone.
I'm here, Fran. Yeah, I'm here.
Okay, go ahead.
My name is Khalid Nixon, Community Assistant for Brooklyn Community Board 9. This week, I would say I just had a lot of productive things done, a lot of things on my to-do list, applications, and, just got regular errands taken care of. So I think it's a pretty good week, a productive week.
Okay, thank you. So Miss Lewis, we're introducing ourselves, and also we are just sharing with everything that's been happening around us, something good that happened to us that really kind of distract us from the bad, and taking the good.
Happy New Day, everyone. Hey, my name is Sabrina J. Lewis, and I am so happy and thankful to just be alive. How about that? How about I woke up this morning? I'm thankful for that. And that made my day. It made my week because I got to see my family all over again. And so I am a chair of health for Brooklyn NAACP, and I also do public health for Sickle Cell Thalassemia Network in Brooklyn. And I'm happy to be here. Thank you, Madam Chair.
You're welcome. Thank you. Is this number 9588? Is it connected to anybody here? Or is somebody calling on the phone? No. Yes. 120-220-39588.
That's me. The 202 number is me. This is Dr. Maniendo.
Okay. So it's connected to you. Okay. All right, so for me, my name is Francisco Leopold. I work for the city as well. I work for with the New York City Commission on Human Rights, the second vice chair at Community Board 9, and the chair for Health and Social Services. And with Mr. Burke, I'm the second vice chair on CABS at Kings County as well. So I love my community. There are different other things that I'm involved in the community also. So the one good thing that had me going is, it's not one good thing, but one of them is when I had my meeting and I was trying to get things going and thinking of how I'm going to get PPEs to people in the community, because people in our community, they're in dire need of masks. We have people who are walking on the streets and they've been wearing a mask for 4 days. You could see the dirt and everything on the mask. And when last meeting that I had last month, and I spoke about it and talking about having a food drive, and it was just felt so good that Enid, who is with us today, I didn't even know, that she said, well, I'm gonna get you some masks. And by the time I was checking and looking at, calling around, they're like, oh, you have mask at the board, Enid sent you a mask. I was shocked. I said, she actually remembered. And, and in no time she was on it. And there were other people in the community as well, other community members who bought masks and stuff. And that made me feel real good that there are other partners in the community who care for the people, for the well-being of people in the community. So I am thankful for you all being here. I know, Anna, how much time do you have? Anna, you are pressed for time. Do you want to go first, or can you wait a little bit?
Me? Okay.
Anna, Dr. Noel, you are the one doing the presentation, right?
Yeah, and I won't take very long. I think altogether I might take up 5 to 10 minutes. I'm not using slides. I just have some information, and then if there are any questions that folks have, I'm happy to take those, or however you wish for the meeting to go. But we can definitely get rolling now, and I shouldn't take more than about 5 to 10 minutes.
Okay, so we have Dr. Noel will give his presentation. Any questions that you have, then we'll have Ariel who wants to give a short presentation also, and then Warren will tell us as to what's happening at the hospital. Enid will share. So anyone who have to share anything, but the two main presentation will be from Noel, Dr. Noel and Ariel. So Dr. Noel, the floor is yours. Thank you so much for being here.
You're most welcome, and thank you. Sorry, go ahead.
Sorry, no, I just wanted to say Teresa Daugherty is here from Test and Trace. She will be, following Dr. Manyendo, and they will be able to take questions together. I just wanted to introduce her as well into the room.
Oh, Terry, yeah, I'm sorry. Okay, Terry, yeah. Okay, no problem.
Awesome. So I'll just go ahead and get started. Thank you again for having me here. So just to get us started, just an overview of the numbers that we're looking at here. Globally around the world, we have now 64.7 million confirmed cases as of this morning. So we're well into the tens of millions of cases. And New York State, outside of New York City, we have about 347,000 cases. New York City has about 318,000 cases since the beginning of the pandemic, confirmed cases. Very sadly, we've had also about 19,600 plus confirmed deaths in New York City. And when we say these huge numbers, sometimes there's an empathy fatigue, there's a sympathy fatigue, there's a emotional fatigue sometimes with these things. The shock value is gone. But these are almost 20,000 New Yorkers who spouses and children and parents and grandparents and neighbors, friends, colleagues, workmates, fellow congregation members, etc., who are no longer with us thanks to due to this awful pandemic that we are all dealing with. And then if you looked at the 7-day positivity rate for New York City, as of today, we're at about 5.2%. So what that means is, of all the people getting tested on any given day, we might have, on some days we have as many as 100,000 people getting tested. Some days we have, around 50,000 people getting tested. But on any given, in the last 7 days, of all the people that got tested, about 5.2% of them came back as positive. So that is 5% is a state level threshold that the mayor has mentioned in the press conferences, not just today, but in the past few days, talked about how this is likely to trigger some type of restrictions from the governor, from the state, because 5% is a state level threshold for a certain category, a certain level of restrictions. And so that's something we can probably anticipate in the coming days for the city. Anna has just shared the link to the data. Highly recommend, if folks want to see this information, be able to get in there. If you go to the nyc.gov COVID page and click on the data link on the left side of the page, you can look at the most current data that we have. It's publicly available. You can look at it as a table, it's tabulated in a table form, or you can look at it by map, and you can hover over you can move the clicker or the mouse over the different zip codes, and you can toggle there and see the various data points within the zip code, so you can get a good sense of what the situation is with the most current data that we have publicly available that is generally very recent data that that's really helpful to inform what's happening. And also just to give you an overview of some of just the epidemiology that we're seeing across the city. I know this is a specific, this is CB9 in Brooklyn, but just to give you a sense, so in the Bronx, we've had, since the beginning of the pandemic, we've had 63,000 cases in the Bronx, of which about 14,000 have been hospitalized. And unfortunately, we've had 4,000 confirmed deaths in the Bronx. In Brooklyn, we've had almost 86,000 confirmed cases. About 18,000 of them have been hospitalized. And unfortunately, we've had almost 6,000 confirmed deaths in the borough of Brooklyn. In Manhattan, we've had about 41,000 confirmed cases, of whom about 26,000 have confirmed deaths. We also have probable deaths that I haven't mentioned here, but it's a significant number of probable deaths, meaning people who maybe we hadn't tested at the time of death to know that they died of COVID. But when we looked at the entire picture, they probably did die of COVID or COVID-related death. And then Queens has had the highest number, so about 88,000, almost 88,000 cases confirmed, about 19,000 of them hospitalized, and about 6,000 plus confirmed deaths. Staten Island has had the fewest at 22,000 cases. It's also the borough with the smallest population, so about 22,000 confirmed cases, and about 1,000 deaths altogether in Staten Island. I will say Staten Island now is one of the areas of Staten Island now that are really hotspots in this city. They have test positivity rates above 10%. And you know, there's a big effort now by the city to really work hard working with the community to try and bring those percentages down. The sad thing is, we know with COVID there's this lag effect. So when you hear about the cases, then you know the hospitalizations will follow. When you hear about the hospitalizations, then you know the deaths will follow. So some of the things that we're hearing of today, the data that's of today, you should know that some of those deaths, probably people got infected about 4 weeks ago in some instances, and may have been sick for the last few weeks and then have succumbed to the illness. So unfortunately, as we're seeing the cases increase, the transmission in the community across the city increasing, you know, that is not a small thing. That's a really big deal. And folks should understand, when we hear that the percent positivity is at over 5% on average for the city for the last 7 days, and some places are even about 10%, it really is a concern, because we don't see the damage done until oftentimes 4 weeks have passed. So maybe the end of this month, unfortunately, we might see what some of this even means. We've heard the mayor speak about this. We've heard the governor speak about this. Community members are speaking about it. We at the Department of Health have been speaking about it as well. And really advising folks to make good decisions around holiday safety. And I was glad to hear, I mean, as painful as it was, I think it was Ariel who was talking about not being able to make it to the, family members decided, not to do the gathering around Thanksgiving. That was probably for the best. That was probably for the best. And also the kind gentleman who spoke earlier and said, ironically, he sometimes had the feeling about the value of having been to Thanksgiving because of all the stuff we all know that happens when family gets together. And this time having a quiet Thanksgiving, again, that was probably for the best. And so just really encouraging that, there are some holiday safety tips. We can provide the link to that information, and making sure that we're sharing that through the several different holidays, all the way. We just finished with Thanksgiving, but there are lots of religious related holidays. We know there's going to be school holidays. There's going to be all kinds of holidays coming up, and just opportunities for us, if we don't handle it the right way, for things to go wrong. But if we do things the right way, and by the right way, I'm talking about the things that we call the core four. So the things that we know allow us to help to reduce the transmission from person to person. So we're talking about, wearing the face mask. I don't know if some of you have Googled this video that's online, where you can look at a simulation of what the aerosolized, the air droplets that come out of a person's lungs, that when we're speaking and laughing and singing and just talking, what that looks like visually. When you look at the microscopic particles that you really can't see with your own eyes, but what that would look like in a simulation. Then you also look at what happens when you wear a mask. and how that contains a lot of it. And then you look at it, what happens when you're 6 feet away from other people, and how that sort of gives, at least 6 feet away, that gives a little bit of dissipation, particularly if you're outdoors, but it gives some dissipation. And then you see what happens if the other person is also wearing a mask, and how that even dissipates even more and thereby reduces. It doesn't make the risk 0%, but it significantly reduces the risk and really gives us a chance to survive this thing. And as New Yorkers and as communities in this city, and I'd even say, I mean, Black and Latino, Black and Brown communities have been disproportionately affected when it comes to illness, sickness, and deaths from COVID. We've also been disproportionately affected when it comes to the economic impact, losing jobs, being in essential jobs, so jobs where there's almost a mandatory exposure to risk every day just so you can get your paycheck. And so just that information there, that knowing that some communities are even hit harder than others, I think one of the things is these same communities and New Yorkers in general have shown resiliency for a very long period of time. We've come through a lot of different things, and we surely will come through this as well. But for us to come out on the other side of this, really emphasizing that all of us are promoting, not just modeling and doing it ourselves, all these things we talked about. So washing your hands, wearing the mask, keeping the 6 feet distance, staying home, particularly if you feel sick. Call your physician, call your provider, let them know. If you don't have a provider, call 311, let them know. But go out and get tested too. Put on your mask and go out, socially distanced. Go and get tested just to make sure you know whether it is COVID or it's not COVID. And then, if it is COVID, then, isolate. And if you have difficulty isolating, our colleagues from Test and Trace are on the call today as well. There's a resource to help you with that. There's a resource to make sure that you're able to do that, a resource that's able to make sure that, reaching out to your neighbors, friends, family, colleagues, people who might have been engaged with you and may have been also exposed and should also be isolating, so that, they're able to reach out to those folks and connect with them and make sure they're getting the resources. Everything from a free hotel with meals, bedding, and all that stuff taken care of. Plus, if you don't want to do the hotel, you want to stay home, they can help you get food to your home so you don't feel like you have to go out into the supermarket and all that type of thing. They can even help you with dog walking. Will have to take you outdoors if you're sick. So there's a lot of resources that have been made available, and everything is just the best we can do. And so we just have to keep doing those things to give ourselves the best possible chance. Just want to also quickly say that this is flu season. Flu shots are being made available all across the city. Thankfully, this flu season, more New Yorkers are getting the flu shot than is typical in New York City, particularly among adults. And so we're seeing a higher percentage of uptake of the flu shot. And this is really important because we know that because this particular season, around this time, so all the way from the fall through the winter, and so in other words, through about March, and nowadays maybe even April and May, the flu season extends over that 6 to 8 month period, that 6 month period from around September, October through about March. During that period, we know annually thousands of New Yorkers end up getting the flu, getting influenza. And when I say the flu, I'm not referring to the common cold. Sometimes people just use those terms interchangeably. The common cold is different. The common cold is different from influenza. Influenza is a virus that kills about 30,000 plus Americans annually. And in New York City, we lose about 2,000 people annually to the flu. And the influenza virus, if it is superimposed, God forbid, with COVID, so if because there's such widespread community transmission right now in the city and increasing transmission in the city, if that is also superimposed with a flu infection, that's really risky because already 2,000 people die annually from the flu. And so that just tells us that it's high risk. So particularly if you have a chronic disease like diabetes or high blood pressure, if you're obese, if you're over the age of 65, if you're a cancer survivor, there's lots of different scenarios. And if that's the case, really do try to get your flu shot. Speak to your provider, but get a flu shot. That's generally the thing that we should be doing to stay safe. In addition to that, everyone should be getting out and getting tested. Get tested frequently. Get tested every 30 days or so. Get out there, get tested. even if you got a negative test a month ago, go out and make sure, especially if you think you've been exposed, especially if you think you are in a situation, you're on that long subway ride in a packed train, a packed train car with people who, some of them were unmasked and coughing and whatever, and you're just not sure. Get out and get a test. There's lots of testing sites across the city that are free. They are regardless of immigration status. They're not going to ask for, if some of them might ask if you have insurance so that they can use it. If you do have it, they can bill your insurance. But if you don't have insurance, you can still get a test. It's not prohibitive, but in some instances they're asking just so that if you do have the insurance, that they can bill for it. So the other thing I'm going to say, and I think I've touched on most of the things. I'll just say that there's the COVID-19 vaccine. We're hearing a lot about this in the news lately. We're hearing some good news about various COVID vaccines that are, so far the studies that are being announced, the results of the studies that are being announced, they are showing they're fairly effective at fairly good percentages. New York City and the state are going to be really looking into these things and sort of also assessing the data ourselves to sort of make sure we know what the latest is and how effective these really are. I think the federal government is requiring and expecting that states are able to start distributing sometime this month. I think the governor mentioned that in a press conference today, I think starting December 15th. So there are a couple of tiers that how these vaccines will be distributed, starting with healthcare workers, obviously who have the most direct risk because of the exposure to the many people that are coming in positive, but also because we need them to be able to take care of everybody, not only with COVID, but also with a heart attack and everyone who's been in a car accident and everyone who has an asthma attack and everyone who, is delivering a baby. We still need the healthcare workers. So we're going to make sure that they get the COVID vaccine first. And then the next group or the next tier of people will be people over the age of 65, people with underlying conditions, folks who live in long-term care facilities, so nursing homes and other such congregate settings. And then, of course, essential workers, of whom there are many. And then after that, I think the distribution will be to more of the broader public, making sure that other folks get it as well. I've mentioned, I think I've mentioned that already. I'm just also going to mention very quickly the mental health impact of COVID-19. So we know COVID-19 has been such a traumatizing experience, I think pretty much for everybody. It would be hard to find anybody that hasn't been, and we're talking here just entire communities, even around the world, just globally. I don't think you can go a place where there's. I think I saw on the news. I think I saw one of the reports, one of the journal reports. It wasn't in the news. One of the journal reports where there are 4 territories left in the whole world where COVID hasn't spread like fire yet, and some of them shut down their access, airport access, or just any type of access, going back to March. But most places haven't had that luxury. They haven't been able to do that. And this is a global problem that we're facing. And New York is a global hub. And so, when Ebola was a problem and it came to the United States, it landed in New York. When Zika was a problem, it landed in New York. When West Nile virus landed in New York. And coronavirus, the same thing. So we know we're not disconnected from the world. And so what's going on globally is important to us as well. Also because there's a lot of people here in all of the community districts who come from or who are first-generation immigrants, second-generation immigrants, or who are visitors from other countries, etc. And so it's just really important to understand that there's mental health impacts all across. Not only that, but also the economic impact and the stress that creates. People have lost their jobs. They're struggling to keep their housing. And these continue to be real economic challenges, and they generate a lot of stress. In addition, we've seen the protests and uprising around racial injustice, around police brutality, around some of these other things. And many of us, have seen the videos of the murdering of an individual, over a 9-minute period, the slow murder of an individual, by another human being at that time. And George Floyd is who I'm talking about. I'll say his name. So I just want to say that all of that stress is impacting people right now. The city has a resource. It's called NYC Well, and we can provide that information as well. You can call, you can text, you can visit the website, 24/7. There are people who provide counseling services. The state also has a similar resource available, and just making sure that people know to connect to those things. But what's really important is communities taking care of each other, neighbors taking care of each other, and where we do the things that we know will build resiliency. Resiliency involves being strong before the adversity hits. But when the adversity hits, it involves recovering from that adversity, healing, and it also involves building back stronger. And for that to happen, there are things that we can do. There are some things that are not in our individual hands to do. So the weak federal policy that we've had to live under as a nation, and we're seeing now record-breaking hospitalizations, new cases, deaths all across the country. The United States, it breaks our hearts, all of us, to just see how badly we are doing as a nation when we have been the leading nation on so many things in the past. And this is not to sound ignorant of the fact that other places in the past have also been handled things better than we have, but we're really underperforming really badly and at the expense of human lives and human dignity and just families and so on. But I say all that to just say that as we see all those things, some of those things at the federal level, we can vote and have an impact in that way. But on a day-to-day basis, there are some things. So we can wear the masks. We can do the hand hygiene. We can make sure we're keeping distance. We can make sure that we're doing those things. And we're not just doing it for ourselves and our families. We're doing it for our neighbors. We're doing it for our community. We're doing it for our colleagues. And so with that, I'll stop there. I'll let my colleagues from Test and Trace speak as well, and I'll be available for questions should there be any. And I'll just also, by the way, really quickly say, my colleagues from the Brooklyn Neighborhood Health Bureau, the Brooklyn Health Action Center, some of you may be familiar with them. They've conducted some COVID outreach in the community, in the CB9 area, and they engaged in other meetings right now, weren't able to join. They wanted me to make sure that I make sure that you guys know that they are also a resource for you. They also wanted me to share with you that I know the 5 zip codes that are in the CB. So 11213, right now the test positivity rate is 2.41%. So that's below the 3% threshold. That's one of the better percentages. 216, which is Bed-Stuy West, Crown Heights West, is at 2.01%. So that's also below 3%. It's trending upwards. 213 is trending downwards slightly. 216 is trending upwards slightly, but it's still at 2.01. That's why we have to keep doing all the right things to prevent that from happening and make sure our neighbors are doing the same thing. 233, which is Bed-Stuy East, Ocean Hill, Brownsville, that's staying roughly in the same area. The percentage isn't changing much. It's about 2.6%, which is also below 3%. So, this is, these zip codes have the luxury of being below the citywide average. Not the luxury, because of the good work of the community in those neighborhoods, and the community must continue to do the same. So 238, Clinton Hill, Prospect Heights, that's at 1.29%, 1.3%. So that's great, and that's where it should stay. Everything should be done, everything possible should be done to keep it that way. And then 225, which is Crown Heights West, Prospect Gardens, it was initially trending down, but it's trending up again, but it's also at 1.7%. So there are places now where I live in Harlem, there's places nearby where I live that are now at about 5%, and we were at 1.7, 1.3, 1.6, 1.8 just 4 weeks ago. And so I just say that to say, encouraging all of you to do your part, work with the community, do whatever you do, all the things that you do and have done to stay at these percentages that you have and even bring them down lower. So I'll stop there, and I thank you all for your time. Thank you.
Thank you so much for the information. So much. I want to thank Melissa, because Melissa was the one who really reached out to the OHMH, to have you guys to come on board. And because she, on our committee, she's part of the Community Board 9, and she's the secretary for this committee as well. And I'm so thankful that she was able to reach out to you guys. And I thank Anna for reaching out to the board, and for you all being here with such important information. So Teresa, would you like to do your presentation now?
Thank you. I won't make a formal presentation. I can certainly be here for questions. What I just wanted to make sure that the committee was aware of is that the Test and Trace Corps, in partnership with the Department of Health, is here for you. I am not a doctor. I work in the community engagement side of Test and Trace. And so our work is really in making sure that as many New Yorkers and as many communities in the different ways that they need to hear it can get access to the information that the city is making publicly available, both in terms of information about the state of health of New York City, your particular zip codes, et cetera, but also the different resources that are available. We know that a lot of people are afraid to get tested because they're not sure about what would happen if they get the answer, especially if they test positive. So part of our work is making sure that all of the resources that New York City has to offer are made clear to every New Yorker that it belongs to them at no cost to them, regardless of immigration status, regardless of insurance. We want to make sure that New Yorkers feel safe and know what they have access to. So I will just share my contact information in the chat box. I also want to make sure that the board, you likely have worked with her before, Monique Chandler Waterman is the Brooklyn Borough Director for the Test and Trace Outreach Campaign. So, and she knows Central Brooklyn very well and across Brooklyn actually. And she is our partner. And so we're happy to work with you as a board, as well as the individual institutions that the board members represent within the communities, to work with you to do virtual or in-person presentations. We do a lot of days of action out in communities, handing out masks, handing out flyers with information, making sure people know where testing locations are. I'm going to share a link in the chat box also. We put out a flyer every Sunday night with all of the testing, the health and hospitals testing options in each borough, because some of those do change weekly, particularly the mobile testing sites, the sites that are being set up for the public in public schools while those schools are still closed. We're in we're in about 25 high schools across the city. We, including the self-test sites, the micro sites that we are partnering with community groups to actually stand up in locations that are not traditional testing sites. These are where we bring self-test kits to, and community members can come and perform their own self-test kits monitored by people who are trained to make sure that the process is done correctly. And that can be done, in houses of worship, in local businesses, in community board offices we've done. So we want to make sure that you can reach us directly. So I will put my information and Monique's information in the chat box. So you know that we're your community engagement specialists who do the on the ground work, but who can also connect you to answers and to other resources. So thank you so much for allowing me to be here.
Yeah, thank you. And I'm very thankful for Ms. Waterman, because on the 23rd, we had the food giveaway and she had her team who came over to the 71st precinct. So they're giving out the literatures and they give out masks and everything. And that too was very helpful. So together with what Ms. Dillard gave us and what Ms. Waterman gave us as well. And so we are very thankful. So thank you guys for the work that you're doing. And in spite of doing that, the work out there, I just trust that your family stays safe and you stay safe as well. Before I
Excuse me,
ask Ariel
Francesca?
Yes.
It's Warren. May I make a couple of comments?
Yeah. Yes. Hold on a minute. Before I have Ariel to come on to do her presentation, I will give like 2 minutes for anyone who have any questions. 2-3 minutes for anyone who have questions for the doctor and Teresa. So Warren, go ahead.
First of all, Dr. Noel, that was an extremely comprehensive overview of what's going on. And I think it was absolutely terrific. The one area I wanted to piggyback on was New York City Cares. And the important message for everybody who was on here is that it's an H&H program, Health and Hospitals, and is for people who are not insured. So let's get the word out, because it's a great program, and everybody can get not only testing, but more importantly, the care that they need. In terms of Teresa, that's a great thing. There are obviously some holes that are going on. And at the beginning of the meeting, I mentioned to Francisca about our senior population, which I am part of, in central Brooklyn. And I think that's something we really have to work on, who are the apartment locked seniors who are being told not to go out, but yet do need PPE. So I thank you both for excellent contributions.
Thank you.
And this is,
Thank you, Warren.
Thank you so much, Warren. And yes, it was such an excellent. I wish that maybe it is something, Warren, Warren, we can work on together, because this information, usually when we come as a committee, we come and then we get all this good information, and then we bring it to the general board. So when they have the 200 people or 100 persons who come to the general community meetings, usually this is just the HSS meeting, and it's just small. And this is information that the community at large that they need to hear. Because a lot of people, they sit in front of the TV and they just listen and they hear everything but that in-depth information, it is so important that the community at large need to hear that information. So we will look, we have Melissa here.
So Francisco, to answer that, you are one of the main activators in our community. And I think it's very important that whoever is on this meeting and has their expertise, why don't you submit what you need to us and see if we can implement it? Thank you.
Okay. Thank you. Any questions for Dr. Noel before I move to Ariel? My main concern, the two concerns that I have, that Warren just spoke about, the seniors in the community. And we need to get enough masks. I think in the early summer, Warren and myself, and together with Little Essential and the 71st Precinct, they gave us 10,000 masks that we gave out masks from Nostrand, Eastern Parkway, and Nostrand to Claxon, over to Utica Avenue, then to Claxon. And I mean, that was just a drop in the bucket. And we're hearing news talking about the numbers going up in our community. I am not shocked at that, because as we mentioned before on previous meetings, people are selling masks. They're selling the masks expensive. People are out of work. They make a choice. Well, I'm going to spend $5 to buy a mask, or I'm going to spend $5 to buy a loaf of bread to feed my family. So what they choose to buy a loaf of bread to feed the family. And I think that is where we as community members have to look out for those who don't have. And as I said, I'm so thankful in it. As you said, if I need any more masks, and as Warren spoke before, we will have a day that we will go out there in the community and then, to give out masks, go to the apartment buildings, package them and give them. So whatever help that we can get, the more masks we can get to give out in the community, it's the better we will contain this virus, and it is very important. I have those little hand sanitizers. If we can get those little hand sanitizers that people, because even the ones that they sell at the store, people won't even buy. But if we can get little hand sanitizers like this, and then we can put them in the bag, at least, give each person 5 or 6 masks, and then put the 2 hand sanitizers in them, it helps. It goes a long way, So I am so thankful for your being here and the message that is brought. And if anyone don't have any more questions, we may have more questions. Dr. Noel, don't go yet. Let's hear from Ariel.
If I may, just because, just to piggyback on what you've asked for, This Tuesday, every Tuesday, we do a Get Tested Tuesday day of action across the New York City. And this Tuesday, the 8th, we are actually going to be in Crown Heights on Eastern Parkway and Utica Avenue. I'm going to put a link in the chat box with the flyer for the event. We will be out there from 8 a.m. to 10 a.m. with Congresswoman Yvette Clarke, and we'll be distributing free masks to the community as well as informational materials as well.
Wonderful. That is great. But one thing I want you to be mindful of, because when we were given a mask, and when those masks for the mayor's office sent the mask, and they said that they were for frontline essential workers. So we were going to the restaurants and shops, and when people know that you're giving them a mask, I don't know how you're giving them, if you are giving them the boxes or you're just giving them individual masks. If you are giving them individual masks, that's fine. But if you're giving masks, people from the stores would come out, they would take it from you and they would bring it back into the stores and sell them. So
No,
what Warren and what we did, okay, because what we did, we went into the stores, but we were supposed to give them masks to use for themselves. And if anyone is coming in who don't have a mask, then they in turn will give them a mask, you know? So what we did, we went in the stores to see if they were selling masks. Anyone who had masks, so the majority of the people who we give masks to restaurant workers because they really needed it. You know, so we have to be, because there are some not too strict people, you know, who want to make a fast buck. But go ahead, Ariel. Thank you so much, Teresa.
Hi, everybody. Thank you for all that information. It's very helpful and eye-opening tonight. So my name's Ariel. I'm a graduate student at the CUNY School of Public Health in Harlem. And I'm meeting with you today to bring to your attention the obesity epidemic that's been growing in New York City. And I was hoping to share some facts with you tonight. So in the US, 40% of Americans are considered obese. The Department of Health states that 1 in 5 New York City kindergarten students are obese or overweight. In South Crown Heights and Leopards Gardens, the adult obesity rate is 32%, which is higher than in the rest of New York City in a lot of areas. 15% of South Crown Heights and Leopards Gardens adults have been diagnosed with diabetes, and 37% of adults have been told they have hypertension. Sugar intake's a main contributor to the weight gain, and sugar-sweetened beverages such as soda, sport drinks, and fruit juice are the single largest source of added sugar and the top energy source of energy intake in Americans' diets. In New York City, nearly a quarter of adults drink at least one sugary beverage per day. And in low-income communities, the consumption rate is doubled compared to that in higher income areas. It's been proven that drinking these sugary-filled beverages on a routine basis increases one's risk of type 2 diabetes, heart disease, and respiratory issues. I think everybody's been saying tonight the pandemic has brought to light significant health inequities that exist in our communities, and obesity is a pre-existing health condition that makes people more vulnerable to COVID. So it's an important time to empower people and give them knowledge they need to take control of their health and protect themselves. And as you know, beverage companies spend billions of dollars every year marketing these sugary drinks, particularly towards children and adolescents, and they don't disclose any of these associated risks. So action needs to be taken to educate New Yorkers on the dangers associated with consuming these sugary beverages. In 2018, public health advocate Jamani Williams put forth resolution 0179, which calls upon the FDA to require warning labels on sugary sweetened beverages. There have been preliminary studies that show that parents who saw warning labels were less likely to purchase these sugary beverages for their children. And this mandate will help New Yorkers be able to make informed decisions for themselves and their families, and ultimately live healthier lives. So I would urge you and your community to support the resolution. 0179. And just, it's a great time to take action to ensure a healthier future for our community members, especially now. Yeah, so thank you. I just wanted to share that tonight.
Thank you thank you so much. Very good information, and with all the complications, you got to be healthy. You got to stay healthy with COVID. You got to take care of yourself. You know, I used to be very lazy. I paid, I think for 7 years I was paying Planet Fitness, and I only went 3 times, and I paid them every month. So, so you know, it's just wake up time, you know, wake up time. So now instead of going to Planet Fitness, because a lot of people been talking about going to Planet Fitness, and when you go to the gym, there are people who don't sanitize after them. There is sweat on the machines, on the benches, and everything. So I just kick it up in the morning. You know, I walk in the morning. You know, it is very important that we have to keep ourselves healthy.
Yeah.
With COVID, we don't know as to how long. And strange enough, I think as I get older, sweet things don't like me anymore. You know, I used to love cake. I used to love to drink ginger ale and pineapple juice and all that, but they don't like me anymore. And I would have cake around me, and then it just don't, you know. So I think that as we really have to, and we have to put the word out there. I guess a lot of people keep saying, oh, well, you know, I've been eating this all these years, and I have been drinking this all these years, but it's time that people really start thinking what's important. Is it what's going in your mouth and the taste, or how it reacts on you and how it affects your health down the road?
Yeah.
So it's very, very important.
Yeah, thanks. Yeah, and people deserve to have the knowledge at least to make those decisions, especially children and adolescents that might not have that understanding. So everyone's finding new ways to take care of themselves these days, and it's just important to spread awareness.
Yeah, and I think that too. I don't know how we're going to do it, because parents who are not working, they look for ways to stretch the dollars, and sometimes the things that they get for the kids, they are not the right thing for the kids. So they might, and you get McDonald's, you always have a special. You know, Pizza Hut always have a special. You know, those pizza places. So guess what? That's what they will go there. You know, we can get a how you call it, snack box or whatever for $1. You know, you can get a slice of pizza and a drink for $1, and that's where they'll go because they want to stretch the dollars. You know, so, and then when we look at our community, it's so disheartening to see the amount of fast foods we have in our community. You know, but then when you look for the fruits that's coming, you may get fruits, but the quality that comes to the community, I just don't know. Because when I go outside of Brooklyn, I mean, the quality of fruits that I see, but then when you go to the supermarket in my area, or even the people who sell on the side, you're wondering, you know, even at my church, we have a soup kitchen at my church, and occasionally when I get a chance, you know, I will drop by to help. And even the fruits that they send to give out to the community, it's so bad.
Yeah.
So why our community have to get the worst? You know, why must our community get the worst? So it is something that we have to look into. I know when we had a discussion with the foods that the kids are getting in school right now, and it was credited to Mrs. Obama, you know, when she was in office, or she went to the schools and then she went to change all these things, because I mean, the things that the kids would eat at home, at the school, and then when they go home, then sometimes the meal they have is still not meals that they should be having, and then they go to sleep. Then when you see an 8-year-old child has a big stomach, you know, what's going on there? You know, what's going on? So it is something we have to We have to get to that place, wake up. I don't drink coffee, but wake up, smell the roses, smell the coffee, smell something, but wake up. And when we have to go out there to do what we have to do, take back our community. I'm from the Caribbean, and I know walking, I know fruits, I know water. I didn't grow up on sweet water. I know water, I know walking, I know my fruits and myself. So we have to, and I think that a lot of Caribbean, I'm talking because I'm Caribbean, I will say it, a lot of Caribbean people, they come to America, and when they come to America, they say, when you're in Rome, you have to do as the Romans do. And then their health just start deteriorating. They come here, they leave the countries eating their yam and the dashing, and the green bananas and the fish and everything, all the healthy food. And when they come here, they forget it. And then they just spoil themselves with all the junk food and everything. And now it has spilled. When I go in the Caribbean, I'm shocked to see all the fast foods they have in the Caribbean. So we have to educate our community. The thing is that I was a number person, and I always look that if we're having a meeting right now and expecting to see 50 and 60 persons, until my deputy commissioner, and he says to me, stop looking at the numbers. The people that you have there, they will take it out. They'll take it out. It will go out. They will share it. So we here have to share. We here have to educate. If you are a part of a committee, that information that Dr. Noel gave, Teresa gave, and each one of you will be given, take it back out there, and then each one teach one. I know it's getting late. Let me hear from Miss Lewis.
Well, happy new evening again. And so tonight I'll just talk about NAACP. And so we're not focusing on COVID necessarily right now. We already know that our churches need to mask up. We've already distributed some masks out to some of our churches, as well as other faith-based organizations in Crown Heights and in Ocean Hill, Bed-Stuy, Brooklyn. And so, we're still advancing the cause for civil rights and social justice. We want to make sure that folks are aware that this is HIV and AIDS Awareness Month. And so we're still continuing to have our folks make sure that they mask up, especially if you have underlying health conditions. And so we're doing a presentation. I believe it's going to be on December 16th. Madam Chair, I'll definitely update you on that particular date, that we'll be doing a webinar on, it's actually a partnership with the Black Church and HIV. And so we're going out to different ministries that are interested in having the conversation with their congregations. We have resources available for anyone that is interested. We have town hall ideas, sermon ideas, and we're taking action and raising awareness that HIV and AIDS is still running rampant within our communities, and places that are frequently visited need to bring about that awareness. And so that's what we have going on at Brooklyn NAACP Health. And if anyone is interested in joining the health committee, we will welcome you with open arms. Thank you very much.
Thank you very much. So I'm looking for us to finish by 8:30. So I'm going to open the floor to Mr. Burke. After Mr. Burke, I'll hear from Cindy, and then I'm gonna hear from Ms. Dillard. Go ahead, Mr. Burke. You had a report from Kings County?
Yes, thank you. First of all, this has been probably the best meeting we've ever had, and I want to thank Francisca for that. All your information has been very important. One thing I do is want to piggyback upon the obesity, because I'm a senior citizen, and I will tell you that what I've seen from obesity and the problems that obesity cause are major as you get older and older, from loss of mobility to hip operations and knee operations and everything else. And to delve into my personal life, my sister, who is older than me, died from obesity. So while we have, the current issue of COVID, this is really a long-term thing. And I just want to thank, I think it was Ariel, for bringing that information to us. So now I'll get on with my report. Okay. First of all, in terms of I was happy to hear Dr. Noel's information in terms of our rates. I do think that within CV9, those rates are a little lower than is actually happening, and that's because we have one segment of our population that we really don't have any idea what's happening with, but we'll see. In terms of Kings County, one thing I'm sure everybody wants to hear is that they ordered their vaccines today. So as soon as the drugs are approved, there's a distribution system that will hopefully get Kings County and therefore our residents the vaccines that are needed. In terms of testing, the testing facilities, because of the cold, have been moved to the T building, which is really right on the corner of Clarkson and New York Avenue. Presently, we're doing about 725 is the average, 725 tests a day, and we have a waiting time of 30 minutes. So with all those, people that you see waiting hours and hours, you may want to consider a health and hospitals testing facility. The Kings County is getting very prepared for the second surge. It's much different than the first surge because they've learned a lot. In terms of the community, I think what's important is that number one, visitations to the hospital, which is a very big issue, is being allowed for at the present time. If the conditions change, and I think what health and hospitals are using are the different zones that Governor Cuomo established. If it goes to red, then visitations will not be allowed. In terms of present patient levels, at the present time today, and it's a picture in time, we have 22 people who are hospitalized for COVID. In terms of planning, there's a very intense emergency plan that has been developed and is going into effect. It's 5 phases, and internally, in terms of the hospital, what that means is that as each phase rises, more of the staff is being allocated to COVID. So the highest phase is phase 5, which will be a red zone. And at that point, the hospital, while carrying on ambulatory care, is equipped to handle any increases in COVID. So what does that mean? Number one, that means there's cross-training of staff. The staff from other departments are being trained to handle the COVID situation. In terms of physical facilities, there have been designated what I'll call cold zones and hot zones, which is different from our last response where we really didn't know anything. And the cold zone are those patients that are not affected by COVID. And there's been a lot of construction to create new wards for people who are sick with COVID. The advantage to that, obviously, number one, is not cross-contamination, but the other part is a concentration of staff who have been cross-trained to handle it. So, personally speaking, while it all sounds good, I think they're prepared, and I'm just hoping that what we've learned from the last COVID, surge, as well as what Dr. Nolan was talking about, is that the major part here is preventative. One of the things that I've been hearing is that the people who are coming with COVID are less sick than initially. And I think that's a very positive thing. And I think that's because of the education that's going on. To reiterate some of the remarks made tonight, you just have to follow the protocols. And the protocols are to wear a mask, not gather in mass, not mass, events. And as importantly, wash your hands and everything else. But I will say that, at this point in time, we have not been, in terms of actual patients, highly effective. Thank you. Any questions?
Hi, Warren, it's Melissa. I didn't have a question, just a comment, maybe you might.
Sure.
Yeah. So I go to Kings County Hospital just as a patient regular, not for COVID related issues.
Yes,
Notice that they have the entrance is consolidated into one entrance.
correct.
Whether you are coming there for COVID related issues or you're just coming there to go to like their regular clinics, like the eye doctor. Is
Correct.
there any plan to make sure that there are separate entrances? Maybe I know like that sounds kind of I don't
Yeah.
want it to be, I don't want it to be discriminatory, but at the same time it's like, okay, if people are going there for COVID issues, the line is much longer. It's a much longer process. So I'm just yeah, if you know of anything.
Sure. Well, first, because I've been subject to this, so the first thing is, in terms of COVID testing, it's now been put to the T building, which is basically far from the medical campus, on Clarkson in New York. The purpose of the one entry, which was an H&H, not a Kings County directive, was to make sure that everyone who's coming in, has no signs of COVID. So, and that's very important for the staff, and we employ 5,000 people there. So there's a special QR code, I think it's called, where the staff gets it and they fill out certain things for COVID. In terms of the patients, you're 100% correct. It's the same door, and they go off into the right into the information center. So what I will do is I'll take your comment and forward it to the people who make these decisions. But the directive was from H&H, and the point was that everyone who enters from the CEO down, it has their temperature taken and it fills out a form. I don't know if this is going to stay the same in terms if COVID surges, and let's hope it doesn't, but I'm going to raise your comment to the powers that be. Thank you.
Excellent. Look forward to hearing back from you.
Thank you. Any other questions, comments?
Thank you, Melissa, for the question. Thank you, Warren. Okay. Any questions for Warren as we move on? Okay, so Cindy, I'll give you 2 minutes, and Enid, I'll give you 2 minutes, and Sabrina, I know you want to add something. So after Enid goes, then you can come on. Go ahead, Cindy.
Great. Thank you so much, Ms. Leopold. And thank you so much to all our presenters. It's a lot of valuable information that has come in today. And I've definitely taken my fair share of notes on a few things that I'm going to be sharing to the rest of my team as well. I would like to let everyone know about a little bit about New York Connects. I do hope in coming next month and providing you more of an in-depth presentation, as we agreed with Ms. Leopold. New York Connects is that information and case assistance portal set out by the Department for the Aging for all 5 boroughs. We actually have a borough office set out by a community organization. So technically in Brooklyn, we are spearheaded out by JASA, which is a local nonprofit some of you may have heard of before. So I work under JASA and under the Department for the Aging. And then every other borough has different CBOs handling their team. But we're all connected, and we're all just very much aware of the current needs and assistance supports that are generally covered and are requested by seniors in the community. We do also have a no wrong door policy, so pretty much anyone who gives us a call will answer to and connect them to the service or support that they need. And it's generally, that is the essence of the line. We're here to help and connect a client over to the resource or support that they need. So we keep a long list of, or database of resources in the community, whether that is insurance information, long-term care supports, food pantry options, food insecurity issues that have been dealt with throughout COVID. As we talk about it so much, it is increasingly concerning. During the early months of COVID, most of our calls were about food insecurity, but as time progresses now, it's going on to financial insecurity, people dealing with evictions, people dealing with so many other pressing issues that COVID has brought along. So we are here to try to connect them over to their appropriate resources. And I'm going to include in the chat our contact information. If anyone has specific questions, we're here to provide assistance to both professionals and clients directly. And thank you again.
Thank you so much.
Of
Yes,
course.
looking forward to seeing you next month on your presentation.
Great.
Enid?
I have no formal presentation, but just wanting to let everybody know that the information gathered this evening was very helpful. Looking to take it back to a lot of our social workers within the One Brooklyn Health system. And for those who don't know, Kingsbrook is now part of One Brooklyn Health, which is Kingsbrook Interfaith and Brookdale Medical Center, coming together to be a more efficient healthcare system. We want to make sure that we also are offering as a system education virtually to anyone who should need it, be they seniors, be they persons in the community, CB9, anyone that needs any type of virtual education ranging from mental health, rehabilitation, pain management, chronic disease management, how to use telehealth as a vehicle for getting your care during COVID. We have just a wealth of information with our doctors and specialists at One Brooklyn Health and want to be able to offer that to persons in the community virtually, where we will support and we will host, just making sure we have an audience that can definitely take advantage of the information, as well as masks. So we do have a wonderful inventory of masks that we are keeping on hand just for our community, for anyone who needs them, to just please get in touch with us and we'd be glad to get them over to you.
Thank you so much. Thank you so much, Enid.
Welcome.
And I'm happy, and I'm so happy that you're part of the family and that you support us every month. I'm looking forward to you being here with us every month. Thank you so much for your contribution to the committee and to the community as well. Ms. Lewis?
Hi, Enid. I'm so happy to see you here. I'm coming to see you. I had to say that, y'all. Excuse me. Sorry.
Dude, we used to work together, Miss Leopold.
Yes, we used to work together at Kingsbrook. And so I wanted to come back and give this last announcement. I don't know how I forgot to make it, but my organization, Sickle Cell Thalassemia Patient Network in Brooklyn, we started a sickle cell support group that I lead at Kings County Hospital. It meets officially second Tuesdays, and we just added fourth Tuesdays as well, just for questions, comments, or concerns. So it's second Tuesdays and fourth Tuesdays monthly at Kings County Hospital Center. We have a WhatsApp group also that we created for the community because they like to interact, and it's a quick resource to disseminate information to our clients, and anyone within the system is able to participate and to join. So I just wanted to put that out there. It's a sickle cell and sickle cell trait support group. We have so many people all over the world. Sickle cell does not only affect African-American families, right? And so we have families and individuals walking around with sickle cell trait, not really getting the education behind it. And so we're looking to really expand our knowledge and our information and educate. We desire to educate the community on the biology aspect, as well as the resources that are available, even if you have trait. So I had to let you all know about that. Thank you so much. Thank you, Madam Chair.
Dr. You're welcome. You're so welcome. Dr. Noel, you wanted to say something?
Yeah, I wanted to just say something about the obesity, but if there were any other folks that were going to say, have announcements or anything, maybe I can go right after them. I just feel like a minute or two, just piggyback of what Ariel had mentioned.
No, just go ahead. Go ahead.
Okay, perfect. Yeah, so I just wanted to bring a perspective on that where, we from the health equity perspective, and everything Ariel said is correct. And I'm so glad she brought it up because it's really important to not lose sight on those common health issues, even though we're dealing with COVID right now. But I think it's important to remember. So I'm a physician, a primary care physician. When you say to a patient, do 30 minutes of moderate exercise 5 days a week, whatever, and you don't know about the walkability of those neighborhoods where that person lives. You don't know about the safety in the park across the street from where they live. You don't know if they can afford running shoes that are comfortable and safe for them to use when they go outside. You don't know if the streetlights work at night when they go out to think. You don't know if they're working 2 or 3 jobs and can just never have the time. Any downtime they have is to sleep and that type of thing. So one of the things I just want to say is that systems of oppression that create ill health and premature mortality through systemic policy things that they do, that change the environment so that a collective group of people act a certain way. The way that those systems work, as Ariel mentioned, they spend billions of dollars marketing a certain way and never announce, they never tell you that side of it. But in addition to that marketing, they spend a lot of money hiding their hand. So they make it a hidden hand in terms of what they do. And what we need is 360-degree accountability. If as public health, one of the things we're doing in public health now when we're looking at health equity is we're shifting the burden of responsibility from individuals. So that idea that know better, do better, we're shifting away from that, because oftentimes, even when you know better, you might not have the budget to do better, or you might not have the resources nearby to do better. But we know that there are zoning and rezoning things that happen across the city. And when you look into the policies that result in square footage and the different things that you can look at that make it profitable for our stores to even sell fresh produce, the things that make it profitable to distribute, so the distribution network and how that whole system works, and which communities get delivered fresh produce last out of the whole batch. And then even just the whole economic injustice that we see going on, to where if folks just had the money, like you mentioned, Madam Chairwoman, where folks might not, they're picking between whether, are we doing this or doing that. And so we know from all the health programming that we do around diabetes, the community health worker initiatives that we have around asthma, childhood asthma, if we don't address some of those other issues, the social determinants of health, if you're not addressing those issues, you're not going to see success. Because a lot of times, and we know as adults, if you have children in your life or grandchildren in your life, you know that oftentimes you'll sacrifice whatever you have to sacrifice to make sure they're covered. And so you might not be eating on time. You might not be filling out your prescriptions. You might not be, getting to all your appointments because you have to balance your jobs and all that kind of stuff. So just saying that at the end of the day, I think it's really important when we have these conversations to make sure that, yes, we must increase awareness in the community so that there are certain things that we can surely do differently. But I think we should understand what creates health. And oftentimes, if you look at the root causes of ill health, you find that it's systemic racism, it's policy, systems, and environmental issues, like redlining, for example, that took money out of certain communities and put it in other communities. And now you just think, well, some communities are just more healthy than others. That's not the case. That stuff, when you see so many people, and it's across the board, so whether it's a communicable disease like HIV or COVID, or a non-communicable disease like diabetes, or or cancer or whatever, you find that those communities always seem to have the highest rates. When you find that they also have the highest rates of incarceration, highest rates of school dropout, highest rates of unemployment, highest rates of living in poor quality housing. If you look at all of those things and you bring it in together, you understand that it can't just be, it's happening to people. There's nothing inherently biologically wrong with people. It's not a bad decision-making. The decision-making they make is based on the options available to them. So I agree with everything that has been said. And I just wanted to say that as a community board and the health committee, you guys should know there's a resource that we have. It's free. It's called the Community Health Profiles. And you can Google that. Just say DOH New York City Community Health Profiles. Some of you may have seen them, some of you may not have seen them. They're updated every 3 years or so. And look back at the last 2 and look at the data for your area and for the surrounding area. And you'll see both health and social outcomes. And you'll see the sort of the equity targets that we try to set as the health department to say, if all New Yorkers had the best performing, if all New Yorkers, so who's the healthiest community? And if all New Yorkers could have that level of health, all those disparities would go away. And when you look into it, those disparities are down to your education issues, down to employment, down to issues around even broadband access, now that everything is broadband, right? So there are little things and big things that you might not even think about. In my previous job, we looked at broadband access in low-income neighborhoods and predominantly Black neighborhoods. And we found that some of that infrastructure dated back to the 1990s. And so imagine the hospitals in those areas, the schools in those areas, the people who live in those areas, and how poor their access to internet is when everything is going on online, and how that's just that one thing holds people back. And it's also more expensive because you're spending more money to get less. So technically, you're getting less for the dollar you're spending. So that makes it more expensive. And so I just say all that to say that anytime we're looking at the health of communities, shift the thought away from, the individual behavior changes and really think, is there a systemic issue going on here? Because what we should do with all of our voice is really challenge. It took a collection of folks, federal level, state level, local level, private sector, lenders, all of that stuff coming together to create the inequities that we see. It'll take a coalition of us working together to break up those inequities as well. So I'll just stop there and leave it at that. I just thought I should really mention that. I thought that perspective is important, just to add to what all the excellent information Ariel said, and I give her credit for coming on even as a graduate student and bringing this great information. Just wanted to add that level, that little bit of that perspective as well, that equity perspective for everyone on this call. And I'll stop there. Thank you for your patience.
Oh, yes. Thank you so much. Thank you. Thank everyone. I mean, we have had meetings before, and Warren would tell me, oh, Francisca, this was a great meeting, but this is what the best meeting we have ever had. And the information, and I've been looking to areas that I want to touch because we will have more people. We want to talk about how the COVID, and when it comes to the mental state of the youth, the kids who are at home, who are working remote learning at home, how it's affecting them, how COVID is affecting our mental health of our seniors, and we were supposed to have somebody who was supposed to do academic awareness of the equipment that like Melissa spoke about, the chair, how it affected her. We have so many of our young kids who are sitting at home, and the chairs they're using, how they're slouching, using their chairs, So we want to have, I know I spoke to you, Anna, you were behind the scene and I didn't get you to, you didn't say anything, I didn't hear from you, so you have to say something before we go. So I'm telling you, this is not the first time you all will be here, and when the next time, we will have a bigger audience because we will put it out there. We will send out a flyer so that the people could come and get all the information, because this is information that just not us need, but the entire community need. Ariel, I know that you're working on a project, but I just hope that, if we call on you and then you could come and give us that report again and even add more to it, then you would be able to do that. You'll be able to come. So Cindy, all of you, I don't want to call names. Each one of you there, I want to continue the connection, I know Dr. Noel, he's busy, but I know Dr. Noel, with all the information that you have given me, I know I am your special family now, so you will make time for me when I do call on you, because I would need you to come back again. So each one of you, Enid and Cindy and everybody, the information was just awesome. And I just wish that, I know that we should take it out there, and I know that we will take it out there to give more information to our community. Anna, I haven't heard from you, so please.
Hi, everyone. This is my job. I'm behind the scenes. I am grateful and thankful for our opportunity to be here today. Do reach out to me with any kind of follow-up questions and meetings. I know, Ms. Leopold, we spoke about your ideas for future presentations and topics. I will coordinate with you to make sure that we have, the specialists, mental health specialists in our department and our teams that will be able to come and speak to the things you're interested in. And, if Dr. Manyinda is not available, please do reach out to me so that we can coordinate to see who can join from our team, so that whenever the meeting is happening, that we can get someone to join. But I'm the community affairs person. I cover Southern Brooklyn and Staten Island in pre-COVID, non-COVID days. And my colleague Teju Made, Jayoba, that you probably are most frequently in contact with, covers Central and North Brooklyn. But please do let me know if any kind of health-related issues and concerns that need to be figured out. And I do look forward to the next meetings. And again, thank you so much. And thank you, Teresa, for joining us today and, all your information and expertise. And it's been a pleasure to work with you. We worked in the past as well. And with Melissa, I worked in the past as well. So it's a pleasure to see everyone.
Yes, thank you so much, Anna and Melissa. I thank you so much for reaching out and then Anna answering the call and contacting the board. So I thank you so much. Thank you, Cindy, for being here. Ariel, thank you. I thank each and every one of you. Dr. Noel, thank you for being with us, taking time from your busy schedule to be with us. Each and every one of you, I thank you. I mean, I'm touched. I am feeling so much information. My head is swelling with all this information, but I'm looking forward to continue the dialogue and to be able to enrich our people, to educate our people when it comes to, because even now at this time where we are now, the things that we eat, and as you said, Doctor, and as I said before, we need better food in our community, and our people need to take better care of themselves. So I thank you guys so much again. Have a wonderful night, but most of all, stay safe. Hope that your families will be safe, friends, work colleagues, stay safe. Blessings to each and every one of you. We will we have your information. So whatever that when the email is going out, you'll be getting an notice as to, because our meetings are the first Thursday of every month. Keisha, thank you so much for being here, for listening. Warren, thank you for the information that you gave. Thank you for the report. Talib, thank you so much for being here with us and setting up everything for us. Thanks everyone once again, and please stay safe. And as I said, our meeting is the first Thursday of every month, and since we have your contact information, your emails, so when we have the meetings, a notification will be sent out to you. So if you can come in, we welcome you. Any information that you have that you think it is something that we can use and we should give it out there, please come in and just join us. You don't need an invitation anymore. Have a good night, everyone.
Good night, everyone.
Good night. Good night.
Have a good night, everybody.
Good night. Good night.